Salam sejahtera diucapkan kepada para penonton yang berada di depan Facebook. So, untuk maklumat anda, program Cancer Awareness UPM 2020 ini bertujuan untuk meningkatkan kesedaran semua tentang penyakit kanser dan juga membantu pesakit kanser. So para penonton diingatkan bahawa paparan merit nanti akan dibuka 2 minit sahaja dan timer akan dipasangkan sebelum program akhir. So pada hari ini dengan bangganya kita telah dapat menjemput Head of Volunteerism and Critical Support dari National Cancer Society of Malaysia, Madam Vijayalakshimy, untuk membincangkan tentang pengalaman beliau sebagai seorang cancer survivor. So dipersilakan Madam Vijay. Okay, so good evening, Madam. So can you briefly introduce yourself?
I am Vijayalakshimy K. Salvatore. Most of my cancer patients address me as Madam VG. I'm the head of the peer and volunteer support, clinical support in Hospital Malacca, and I also do counseling at our office.
Okay, so we know it's very hard to invite Madam VG to attend our webinar. So everyone is encouraged to ask any questions if you have. Okay, so Madam VG, so I've heard that you are a cancer survivor. So can you describe briefly about what cancer you got, which stage is it, and what are the surgeries and treatments that are given to you?
I'm a second stage breast cancer survivor. I have had a surgery which is called mastectomy. That means completely one of my breasts has been removed. I have had 6 chemotherapies done, and that is medication provided through my veins, and 15 radiotherapy, which is actually treatment through X-rays. These were my treatments for my breast cancer.
So you have breast cancer. So how did you first find out that you have this disease?
I've always done self-breast examination every month on the 7th day. And as usual, when I was bathing and I did a self-examination, I found a lump. It was a Friday evening. By Tuesday, I had done a mammogram and an ultrasound. Wednesday, I did a biopsy. Friday, I was informed I was having breast cancer and was operated on Saturday. It was a roller coaster ride of the worst kind, the most scary kind.
Oh, so okay. So throughout the process, is there anyone accompanying you and giving you mental support when you are sick? Families? What did they do to help you?
Okay, my family is very wonderful. I've got a very wonderful family and a very supportive group of close friends. The day after my biopsy, as I was coming home, I asked my husband, will you still love me when I have only one breast? Without batting an eyelid, he replied, I fell in love with you, not your breast. And I knew that I would survive this journey if I had such a spouse. I knew I was in for not a bad ride. And then when I was going through and my hair started falling during my first chemotherapy, I decided to go bald immediately. And one of my sons went bald with me. Both my sons and my sisters always looked red, talked to the doctors, found out what was best for me, and always provided me with it without hesitation or without any rancor or anger, anything. It was always with love. And the best thing I loved was after this time, my sons and my family members always remember to say, I love you to me, which I love.
Oh, yeah. Okay, so yeah, we know that family and friends, they are very important, like in giving us support in our life. So,
yes.
So actually, it's very hard for us to accept that we have a disease such as cancer. So can you tell us how is your feeling when you first found out that you have cancer? And also, how do you feel when you finally recovered from it?
Oh, when I first heard it, I was in deep shock. I was so sad. I became like a zombie. At first, I couldn't understand. And then I was thinking, oh, death is imminent. I'm going to die soon. Whatever it is, whatever I do, I'm going to die. And then there was so much of anger. Why me? What did I do wrong? Why am I being punished? All those things were going through me. But as time went, I decided, why not I become the best patient the doctor could have? If he said jump, I'll ask how high. If he said run, how fast? So I decided to become the best patient the doctors or the nurses or whoever was treating me or looking after me could have. And that is what happened. And once I became better, I found my perspective in life change. My personality has had a big change. I found that I've become stronger. I have become more confident, bolder, and I'm able to face any challenge. After all, I beat cancer. I can beat anything, can't I? That's
Yeah,
what I think. I think I'm a big warrior now.
yeah, yeah, definitely. Okay, so I've heard that now you are the head of volunteerism and also clinical support from the National Cancer Society of Malaysia. So can we know about what activities that the NCSM usually does for the patient, and also what are the services given?
NCSM has a diverse and suitable, relevant programs to meet the needs of our patients and caregivers. We have a team of dedicated, trained navigators who are able to guide the patients through and help them steer each patient through their various treatment procedures. We journey about a year with them, and this we do in every department in the hospital. We are there from Monday to Thursday, and though we started with breast clinic, we have now gone on to breast, lung, gynae, surgical, ENT, skin, and eye. So we are all over, and all the patients with the different diseases, with different cancers from the different departments can seek our help, and we guide them. On top of this, we also have an onco-dietitian who is a specialist for cancer patients, and then we have a plate therapist and 2 psychologists. So sometimes the patients need more in-depth, not a psychiatrist maybe, but in-depth counseling, and for that we refer these cases to them. Some patients also need further, we do the counseling in each of the rooms that we have in the hospital, but sometimes patients need more, longer counseling, and so we bring them to our office. And in the office, sometimes we give group counseling, that is for the whole family, not 2 families, but the same family, a big group, the whole family, or a particular person who is having difficulty in accepting their cancer. Sometimes it's just the spouse of the party. If the husband has sickness, the wife might have difficulty, or the wife, the husband might have difficulty. We talk to them, we make them understand what is happening. And so this is what we do here. And we are also having a lot of ongoing projects for survivors who are constantly told to further, so that we can further motivate and keep their spirits up even after their treatment is over. So all the patients have our numbers, so they can call us. So each patient has 1 navigator assigned to them. They don't have a team or something. So if I am seeing a particular patient, she knows Madam Vijay, I can call Madam Vijay and ask her, tomorrow is my chemo, I can call her up and ask for further advice. Or I'm vomiting too much, should I go back to the hospital, or should I tell the doctor, or should I, it's just a little bit and I can manage it, and then we give some advice. So this is something that is very, very useful, and patients find it very helpful for them.
Oh, okay. So can you share what activities that were held by NCSM during this pandemic? Because since we know that the MCO restricts our movement, so are there any differences between during this period, and what are the steps that you guys have taken to overcome all this during the MCO?
Okay. Since the MCO came in, we were not allowed to go to the hospital. Suddenly, we are not seeing the patients, and the patients don't have access to us. So we came up with this plan and talked to all the heads of departments of the various discipline, that is the surgical, the gynecologic, and said, after you've seen the patients, can you send us the names? So they will send us the list of names, say 15 names that they saw of cancer patients. They just write their IC number, their telephone number, their names, and what cancer it is, and when is the next visit to the hospital. We then call them on the phone and find out how they're coping, because now they're not only coping with cancer, they're also coping with COVID, and sometimes there's loss of income or less income. Sometimes both the families have lost, both partners in the family have lost their jobs. So there's a lot of other difficulties. And now traveling, coming for the various appointments, only one person can come, the patient. There's no person with them. So it means if they're going for an operation, we have to motivate that patient until they are so sure of themselves that they can go to the operation on their own. So we are talking to them by phone all the time, and this takes a lot of effort. And I must say shabas to my team of navigators who put in so many hours of calling. I think the phone is stuck to our ears now.
Yeah, so it's really meaningful, like, to help the patients. So
also,
may I know, like,
I forgot. Sorry, I forgot to mention that in Sabah in July, we talked to the onco gynecologist there, and we have started video counseling with Sabah. So we are also helping the Sabah patients there. We are also, many of the patients didn't have enough food or vegetables and all. So in the early stages, if you see, our volunteers were trying to get vegetables, food and everything, and were sending it every 2 weeks to some of the families. When MCO suddenly hit and many people just didn't know where to go for help or aid, NCSM actually did step in many households to help them alleviate this loss of income and money reduction.
okay, so like it's really nice to have these patients, like, to be able to help them. So what makes Madam Vijay want to be a volunteer at NCSM?
Okay, my first reason, I must give full credit to Mr. Safian, the surgeon who operated on me. When I was going through my journey, he kept on saying that I would make a good counselor or a navigator, and he wanted me to come back. He was the one who kept pushing me. So the minute I was tail ending, I had a very good person who was counseling me at that time, who was associated also with NCSM. So she put me on to that. I was very lucky. I got directed to a very good source, and then I went in, and they were starting a training in August, so I immediately joined them and started being with them. And since I've been with them, one of the things I found is I don't concentrate so much on my knee. I'm not thinking of recurrence so much. I'm not wallowing at home and watching a lot of serials and things like that. I find that I get back 1,000,000 times more from my patients than I actually provide them. They are making me sane, healthy, and also enriching my life so very, very much.
Okay, so we know that cancer patients, they are suffering, especially during this pandemic, like you said, like they had no income or this. So like, what service or helps from the association or government do you think the cancer patients need the most when they are diagnosed with cancer?
At this time with pandemic, the biggest difficulty, and I think the government also has the same difficulty, is that they cannot play around the SOP. So they cannot say, okay, 2 people can be there, so only 1 patient. So the thing is for NGOs to step in, but there are other things that they can help. Maybe now a lot of the patients find they have to be sent, especially from Malacca. We send a lot of patients for their chemotherapy and radiotherapy to IKN. The traveling at this time when they have no money and reduced wages is a big hole in their pocket, leaves a big hole in their pocket. They're finding it very, very, very hard. And so sometimes between treatment and food, maybe it will go to food to put on the table. So that is very, very sad. I think a little bit more awareness also should be made public. People should be made to understand what cancer is, and so patients will come earlier for treatment. That is very, very important. And I think some of the hospitals also need new machineries. I think that should be a big priority for many of the hospitals. Some of the machines are really overworked and doing a job long past their age. So we need to replace them also. I think these are some of the priorities that they have to look for where cancer is concerned.
Okay, so we can see that actually the society helps a lot for patients. So in your opinion, how can the community help patients that have cancer?
Community is made up of so many people. If you are an employer, try to be empathetic to a colleague or a staff who has got cancer. If you have a classmate or a friend who has got a cancer, try to be helpful. Money is not everything. Time is the biggest thing that we need to have, and that is many of you at your age even, if you have a friend or a friend's mother who's got cancer, you could make a meal and go and give them. Help to say, we will look after the children, have a rest. Because sometimes the mothers have got no time to sleep even very well because they have to look after the younger children. And if they are older people, say, I'll cook a meal, take them to the hospital, go with them, accompany them to the chemotherapy. These are some of the things that you can do. Go marketing, pay the bills. They're willing to give you the money to go and pay the bills and all that. But if you can do certain things for them, it will be very, very helpful. But the most important is if you can go with them when they are in hospital. Accompany them. This is very, very important that you should do.
Also, in your opinion, how should these cancer patients be treated by the doctors and also the family members?
Family has to be loving, caring, supportive to the patient. Accept that the mood swings, fears, and confusion that they are having is all part of the cancer journey. Cancer does not affect only the person, but affects the whole family. And doctors should give easy explanation so the patient understands what the next treatment or what they have to look forward to. Explain it to them. Sometimes you forget we are still living human beings. We become like part of the wallpaper, Sometimes doctors talk only to the family members and not to you. We also want to be included. And when the family is having a discussion, realize just because we have cancer does not mean we have become dumb or blind or deaf. We are still there. We have our contribution to the family, and what we say matters. When you ignore us, we feel we are already a living dead. You're not even listening to us when we are there. We feel very hurt when you do that. Anybody does that, irrespective of it being a friend or a colleague or a doctor. I say I've got a pain. Every night I get up, listen to it, what she's telling. Unless you're very sure she's imagining it. But listen, sometimes it is there. The pain is there. It might be more serious than you think. Listen to her. Listen to him, whoever the patient is.
Okay, so in conjunction with our program, the Cancer Awareness Week, do you, Madam Vijay, have any messages to convey to the public or to students who are watching now?
Look around you. If this is the last, and see how many of you have got friends who have got cancer. How many of you know that males can get breast cancer? Are you aware of it? Sir, are you aware of it that males can get cancer? They get cancer, breast cancer. So, and there are more and more people suffering from cancer. This could be because of awareness, but all I want to do today is plead to everybody, actually plead to everybody to take better care of yourself. Take notice of the different signs, the signals, and the things that your body tells you. Heed what the body tells you. If there is loss of weight or appetite, if you stop smoking, if there is blood in the stool, if there is a lump in the breast, go and see a doctor. It does not necessarily mean it is cancer, but it could be something that is treatable. Sometimes it can be a cyst which can grow into being something more dangerous. So go and see a doctor. Know your body very, very well. You take so much of time to learn how to use the computer, your handphone and everything. Learn to be in tune with your body. That's what I would say. Love your body, love yourself, and keep healthy. Be healthy.
Okay, so thank you. Okay, so I've heard that Madam Vijay, you have bring along some pictures. So,
Yes.
like, can you share also? Will display it? Can you
Yeah.
share about the story of these pictures?
Yes, if you put them up, I can tell you each one what it means.
Okay.
Yes.
Okay, so that's okay. This is the first one.
Okay, this is the first one. This is the picture where I first went out after I had my cancer. A couple of months after my cancer, and I started training in Dr. Hanifa and Puan Pute's house, where I was trained by NCSM volunteers and psychiatrists, psychologists to start my journey to become a navigator. This is my training session.
Okay, so the next.
This is at us. We're all very, very 1 foot apart. Every Tuesday, because of MCO, we are now, as I said, doing telephone counseling. We come on Tuesdays to see and review the cases that we have talked to for the week and see whether which are the cases that needs more close watch, which are the cases that needs to be referred to the psychologist or to the oncologist or to the oncodietitian. Those who need to come on a one-to-one, face-to-face discussion. This is what we are doing here. This is Relay for Life. I don't know how many of you know what Relay for Life is. This is our biggest fundraising program. And this year we wanted to say heroes, that every survivor is a hero. And that was my costume that I was wearing that year. That's me in that yellow. This was one of the last photos taken of some of our navigators and some of our volunteers with NCSM. We just did a group photograph just before, I think, MCO. Before COVID started, we had this group photograph taken. This is our wonderful group of Zan. The lady that you see with the black pants at the top is actually my houseman who looked after me when I had breast cancer. My doctor was Mr. Safian, and she was my houseman. And these are the very dedicated nurses who have been looking after and are looking after me. And now they've extended their services so wonderfully to every single breast cancer patient that comes to the hospital, Malacca. This is our breast clinic in Malacca. This is our group session when we do sharing. This is once a month, we do a bit of sharing about our work when we talk to cancer patients. Sometimes we lose a patient and we are very sad within us, you know. And so we have a psychologist who's there who talks to us and helps us deal with death or patients who are nearing death or patients who have decided to try an alternative way of treating themselves because it is their right. They can choose what they want to do. Our capacity is to help them and guide them during that time. And if they decide they don't want to go with conventional medicine, we cannot force them. If they are very adamant and they want to go with a different, we just follow with them. This is our discussion group. This is 2018. This was a very sad year for me. I was on a Wednesday, I was told I might have ovarian cancer and I was operated on. both my ovaries were removed, and luckily it was not cancer, it was benign. 2 days later, there was a problem with my first operation, and I had to go in for another emergency operation just 2 days later. This was Wednesday, and then the Friday, and they told me that I might need a stoma bag. I don't know whether you know what a stoma bag. It's when all your waste products come off and it will be at your waist level, They have closed your anus and then the waste products. My whole world like shattered, and I told the doctor, you can't give me a stoma bag, please, not a stoma bag. And she kept telling me, don't worry, even if we give you a stoma bag, it's for 6 months. And luckily for me, I didn't need a stoma bag. And the following Tuesday, I got discharged, and Saturday was our relay for life. And my surgeon was, my gynecologist was the MC for the program, and he said I should come for this program and show the people that, you can do anything you want. So I just came there and went around the field once, and then I went back home. That's why I couldn't even walk. I'd had my ovaries, and then I had another second operation, and I came there 4 or 5 days after I was discharged. But I'm very proud of that moment. This is 1 year I decided to go to kindergartens and get them involved in this program for Pink October. Pink October is for breast cancers, And I went to the school and I said, there are ladies who are suffering from at that time we were only doing breast cancer. So I told them that there are a lot of ladies who don't want to do the chemotherapy or the operation. They need a lot of love and hug and all that. So I said, why don't you put your thumb impression and send all your positive energy to the ladies in the hospital, and maybe they would love. And that's what the children in that school did. I went there to meet them, and all the kids put their thumb, their handprints on it. It's a lovely day. I still remember it so well. This was quite recently when we had a small get together, just to remind everything that MCO, COVID, all will end, and we will see happier times again. This is our Tuesday meeting group again. Our Tuesday meeting group. All the ladies are there. This is my fantastic Jenny Kim, who actually journeyed with me. She was actually my sister's friend. My sister told her that I had cancer, and she was so wonderful. The first time I didn't know her, she didn't know me, but the first time she came just a few days before my first chemo, she came with a wig, a prosthesis, and some notes and papers and all about what I should eat. And the wig was for me, if I became bald, to wear, and then the prosthesis was to give me confidence to go out. And she journeyed throughout. I've kept her dear to me, and she came every time, a few days before my chemotherapy and a few days after my chemotherapy, to see such dedication. This is me being the food and beverage head during Relay for Life also. Thank you.
Okay, so thank you, Madam Vijay, for sharing all these stories. So it's really heartwarming, and thanks again for the whole sharing session, which is really informative, especially about the volunteering stories. So terima kasih kerana sudi berkongsikan pengalaman Madam. So jadi untuk pengetahuan semua, pelajar telah digalakkan untuk bertanyakan soalan. Okay, so Madam Vijay, so for the first question we have here. Okay, so yeah, this one, during chemotherapy, what motivates you to get better? So I believe it's hard to go through.
Yes. When I went for the first chemotherapy, I was clueless. When I saw the doctor coming towards me, I was so frightened. He was wearing goggles and then a shield, and then he wore 2-3 clothes, 2-3 protective layers. He put 2-3 protective layers over me. And I have a problem with my needles. I can't put the needle into me. So I had to go into surgery and have a special pot put into my body. It's here. It's called a chemo pot, and my medicine was put through there. I realized one of my sons was not very keen that I go through chemotherapy. And I discussed and I read a lot about chemotherapy with my oncologist. And I realized that my best chance for survival was to go through chemotherapy. And it is not easy. You take each day as it comes. If today you feel giddy, you feel nauseated, lethargic, you don't want to talk to somebody because you have very bad mood swings, go with the flow. Another day you'll feel uppity and you want to go and cook and everything. I do that. And I kept myself sane by writing a book of my recipes for my sons. I played Sudoku. I did gardening. I did a lot of different little things. I learned how to knit, and that kept me sane. But the biggest reason for going through chemotherapy was to be with my family. I love my family very much.
Okay, so for the next question, which case is the most special to mention? Maybe like the volunteering in SCSM. Yeah.
Every case is successful. If I can just make a little bit of change in one person's life, I feel it can be a case that has gone on for months before they say yes, or it can be a case that I did it within a few minutes. I went about 2 years ago to Sabah, and this lady had refused to do the operation or do the chemotherapy for a very long time. She has refused. The doctors had brought her specially to ask me to talk to her. And I sat there and I talked to her, and I don't know what happened. I was not speaking her language. She was not. We were using an interpreter, and I was amazed. I don't know what I did or said, but within 5 minutes, she told the doctor yes. And the doctor was a Chinese doctor who was with me. Ask her, after the operation, will she do the chemotherapy also? And she looked at me and said, whatever the lady tells, I will do. What I tell and she will do. I was amazed that I was able to change somebody, and some other person I might take a very long time. This was one of my fastest. So at the end of it, I even wanted to ask, and I asked her, why did you say so fast to me? And she said, you never looked at anybody else except me. You looked in my eyes, you talked to me, and you focused on me, and you made me feel special. And I've never forgotten what she has said. I always do that with my other patients now. I always focus on them. I learned something from her that day. Everybody teaches me something. Yes, yes.
Okay, so now for the next question, how should we reach out to NCSM for help if we are taking care of a cancer patient or we ourselves are suffering from cancer?
Okay, I'll give you the number 06-292-1231. This is our office number. The minute you say you need to see a patient or you have a patient that needs a bit of care or advice, then they will most probably transfer the case to me. They will let me know that somebody in the office will take all the details. If the patient needs only a Chinese speaking navigator, we will assign a Chinese speaking navigator. If you need, sometimes they will say, I want to speak to a Malay navigator or an Indian navigator, or they can only speak Tamil, then we will sort it out for you. But if they don't have anybody, any one of us will deal with the case. It is who is best suited for them. That is what we will see. Sometimes we have people who are of the same age group who have had that cancer, which will be a very beneficial, will benefit them better. We will guide that person.
Okay, so it's so hard for the cancer patient to make a decision to remove parts of the body. So what did led you to make such a decision?
There was nothing else I could do. It was either I remove my breast or I die, because the thing keeps growing every day. I've read enough, and I've read enough books on women who had cancer and died, breast cancer. And so I was very aware of what happens. And I knew my best survival rate was removal, total mastectomy. I had to do a mastectomy. I was very lucky my lymph nodes were not affected. But even then, they removed 18 lymph nodes from me. And because of that, sometimes my arm gets a bit swollen or it's painful, but it has never come to the side that it has become a lymphedema or anything like that. I do the exercises, I rest it, and I take better care of my arm. But you have to be very careful all the time because at the back of you, there's always the fear of recurrence. Recurrence is a big issue that all cancer patients face. Very big issue.
Okay, so for the next question, is there any of your family members that can't accept when you have been diagnosed with cancer? So if yes, how did you manage to overcome it?
Okay, I'm very lucky. My husband is actually a veterinarian. My sister is the head of department for ophthalmology in hospital. At that time, she was the head in Hospital Malacca. So I come from a very big family of medical background. So I was aware of what medicine is. My kids were also very, very into what is best. Let's ask the doctor in the families to make the decision. So they made the decision and I went with it. But the hardest thing was to accept was, I think, when I had to lose. And finally, the day I accepted it, I had a little bit of issues about accepting is because I was, as I said, roller coaster. I started on Friday and I operated the next Saturday. So I had no time to use, if I should use this term, mourn the loss of my breast. I didn't have a time. So I only mourned about it a long time later. And for a long time, for a year, I never said I had cancer. I always said, I had the big op. And then I would say I had the big C. And it was the first time that photo that you put in, the first photograph you put when I went to Puan Pute's house, that I actually said, I'm a cancer patient. And that's when I started crying. I cried in between. There were times, but that day I broke in public and cried. So it's not easy. Losing a breast is not easy. And it is not easy even to today. I will tell you an example. Like if I go shopping with my sisters, there was a time when they bought me a blouse. I was going somewhere and I wore it and the cut was so low that the hollowness in my breast could be seen. And I said, no, the blouse is not nice. No, it will suit you. No, it's not right for me. No, it will suit you. Finally, she said, why are you being so adamant? And I said, okay, it's because my hollowness is visible if somebody's standing. Oh, I'm so sorry. And ever since then, when I say it doesn't suit, nobody in the house questions me. They know that the neckline is low. That's a bit of the problems we have, the ladies who have had breast examination, I think, breast mastectomy. That's a big problem we have. We never forget we have lost it because every time you bathe, every time you change your clothes, you're reminded you've lost your breast. It's very hard. It's very, very hard.
Okay, so how can we volunteer to join NCSM to help other people?
Okay. I would love to have anybody, especially if they're in Malacca, come and join me. I need more navigators. We have more work to do with cancer patients. But if you do not, there are some people who can't meet cancer patients. There are other things that you can do. The office work, weekend, awareness programs. There are so many things going. And if Malacca is not suitable, you can volunteer at the KL NCSM. You can also during the holidays come for a short time and do short programs with us. Anytime, you're most welcome to come and join us. There's no payment, there's nothing. There's just a form you fill in and let us know what are the days you're available and when you would like to come and which is the section you like to be. Like to do office work, you want to do outdoor work, you want to be involved in only certain programs. I can tell you some of the programs I'm having in January, and if you're free, you can come and join us for that and help me with it.
Okay, sure. So for this one will be the last question for tonight. So did you face any obstacles during your treatment? If so, how did you overcome these obstacles?
Obstacles meaning during the treatment itself. I think one of the times when we had the, chemotherapy dated, I think it was my third chemotherapy, my doctors had decided there was only one doctor, and I would like to say his name, Dr. Teh Sebun, such a wonderful doctor who was to give my chemotherapy every time. My surgeon decided he will be it because I'm very difficult to get in the line, so they had to suddenly go to KL with a small baby, and he had asked another doctor to put in the line. She couldn't get the line in, and blood must come out from that line when they put it, then only they can put the medicine. They couldn't. They kept on trying and trying. They changed the needle twice and we couldn't. Then another specialist came and said, "Can I twist it?" And I thought, oh my God, okay, let's twist and see whether it will go through. It didn't want to go through. Then they were thinking, shall we just give the medicine in? But you see, if the medicine does not go through the correct place, the chemotherapy medicine, you can burn your skin and it will be dark for the rest of your life. And Dr. Teh had told me that when there's no backflow, I should never allow anybody to give me the medication. I didn't know what to do. And I have 4 injections, and each injection takes about 12 to 15 minutes to be administered into me. He tried, and the lady tried, and then it was going in. And what a wonderful guy this Dr. Teh is. He reached ICRO and he calls me and he said, "Madam, have you finished?" I said, "No, I'm still here." He said, "What? You have not gone home?" I said, "No." I said, and I told him what was happening. He said, "Ask them to stop. I will come." I think he must have ran all the way. They were still giving the first one. And he said, "No, we cannot go. We have to go into the special room." And he said, "I have to twist it or I put a new needle in." He said, "We twist and say," but then we did some exercises. It didn't work. He said, "Let's twist." Twist means there's a big nail inside like thing and they're going to twist it. It's not an easy thing. So he gave one twist and it worked, and then we went on. But at the long run, I admire the dedication he had. I still enjoy seeing him in the surgical wards. He's a blessing to all the patients. I should say all the doctors and medical personnel in Malacca Hospital are a blessing to all cancer patients. They are very dedicated. Very, very. I've not seen anyone being harsh or treating any patient badly. So I must say Malacca is very, very lucky to have such a wonderful team in each department I'm talking.
Okay, so that's the end for our Q&A session. So again, I'd like to thank Madam Vijay for sharing all her experiences. So, okay, sekarang sampailah saat yang ditunggu-tunggukan, yaitu paparan merit. QR code dan link akan di-sharekan dan pelajar diberi masa 2 minit untuk scan dan menjawab form tersebut. So, pelajar boleh mula sekarang.
I don't know. Have a good day, okay?
Okay, so sampai sinilah webinar kita hari ini. Salam sejahtera dan jangan lupa esok pukul 12 tengah hari dengan platform yang sama kami akan ada webinar lagi yang berkenaan dengan kanser dari Dr. Nurul Yakin. So sekian, terima kasih.
I don't know. Have a good day, okay?